Hello everyone, I'm Kirti Agrawal and I'm very happy to see you again. And today my topic is going to be meningitis, and as everyone knows that I'm making a whole series of all neurology topics one by one. And today's topic is really very important from your MCQ, your theory exams, from your clinical practices, and this is really very important to integrate with other subjects and understand it well. So I have divided this whole video into two parts. Part one speaks about the clinicals, while the part two will be more about the microbiology part, like which are the organisms which are going to cause meningitis. And the common case scenario that you will always get on this topic will be a male patient coming with headache, nausea, vomiting, and nuchal rigidity, Kernig sign positive, and some CSF values like the lymphocytes are high, the neutrophils are high, and the CSF pressure is high, glucose, protein levels of CSF, which will help you to differentiate between the fungal, viral, TB, and the bacterial meningitis. So, in order to differentiate, you have to see this whole video. So, let's start with this whole topic of meningitis. I have integrated subjects like microbiology, medicine. Of course, it is a one kind of infection, so microbiology is really important. Then we have medicine, some parts of community medicine as well, and pediatrics, radiology, and pharmacology. Now, what is meningitis? Meningitis means there is an inflammation of your leptomeninges. Now, what are the meninges? We have three meninges, right? Dura mater, arachnoid matter, and pia mater. But if there is an inflammation in arachnoid matter and pia matter, then plus the CSF, and the cause can be infectious causes or non-infectious causes, can lead to inflammation of the leptomeninges, and this is why we call it as meningitis. So, as I told you, that common case scenario that you get will be like having fever, headache, nuchal rigidity, vomiting, sleepiness, and irritability, and delirium. If the treatment is not being done, then delirium can be one. But usually in the questions, you don't get delirium as one of the clinical signs or clinical features they give. Now, if I explain you one by one, fever, like of course, fever will be there because the patient is having infection, right? So it can be one. Next is headache because the CSF pressure is increased already. So that's why the CSF, which is going to surround all your brain, can lead to headache. Also, nuchal rigidity is because of the CSF pressure increasing, and also the vomiting symptom is because of increase in the intracranial pressure, while you can see irritability sign mostly in case of neonates, and also sometimes not in case of adult, usually not in case of an adult. So these are the basic clinical features that you will be given about. Now, what are the signs which you can see in cases of meningitis? See, meningeal irritation signs are because of the meninges, which are meninges as well as the CSF, which are being like CSF. You consider like a bottle that is full of water. So, if the CSF, like if there is a certain amount of water, right, in the CSF, which is the CSF. So this will be having a particular number of cells, some cells, and like cells and everything is fixed. Now, if the number of cells start increasing, or if the bacteria tries to fit into that water, the pressure of the water will be increasing, right? And that's why we are going to see these meningeal irritation signs. Now, the nuchal rigidity is like neck stiffness, and nuchal rigidity is just checked by taking the patient's head and then moving it in a forward direction, and touching this chin in a chin to your chest. This way, you can see that the patient who is having meningitis will not be able to do this, and you will feel that there is a rigidity, and you are not able to move the head closer to the chest. Move the chin closer to the chest. Now, the second sign is the Kernig sign. Now, word Kernig sign, you can just break K and E. The K is for the knees and E is for the extension. Now, you can see in the first picture, like the first picture there, the in Koenig sign, what you do that there is whenever we are going to flex the hip of the child or the patient and try to extend the legs, you will feel certain kind of resistance, and the child will not be able to move extend the knees from the knee part. Okay, there is a flexion at the hip part, but if this is a like this is a part, so if this is the okay, we consider this to be hip part. Okay, this is the body, this is a hip part, and here are the knees. Okay, so now hip will be always in flexion, while the knees are the one which we are going to try to put in extension. This is the extension and this is the flexion for knees. So if we are going to extend, we can feel that there is a certain kind of resistance, while in normal people who do not have meningitis, this will be an easy move. The third will be your Brzezinski sign. In Brzezinski sign, what happens is you are trying to flex the neck. Flexion of the neck can lead to flexion of the hips and the knees. That's why we called it as a Brzezinski sign. The fourth sign is your Amos sign or the tripod sign. Now you can see a picture of the patient there. In this sign, what happens is we are telling the patient to get up. We will say the patient to lie in a supine position, and then we will ask the patient to get up from there. So what these kind of patient does is they are going to use their hands for support, like in this picture, like they are going to use their hands for the support behind, and then they will be able to get up from the bed. So this is the tripod sign or Amos sign that we say. The next is your accentuation test. In accentuation test, what you do is you say the patient to keep moving the head 2 to 3 times. Now this is going to keep increase because of the pressure. The patient will not be able to do this for a very longer period of time, and that may lead to pain to the patient. That is what we call as accentuation test. Now, as I told you that these signs will be easily seen in cases of an adult, but in case of an infant, it is going to be very difficult to, because infant, most of the things like they are not completely developed, and that's why these signs are not specifically seen in them. So for infants, like they are going to be irritable. There will be branching frontale, and poor feeding will be there. So from that, we can try to make an diagnosis, and also we are going to do LP, that is lumbar puncture, for them to make a correct diagnosis. Now, what we do is, like I told you, like we are going to do lumbar puncture for all these kind of patients where we suspect that the patient might be having meningitis. Now, the CSF that we are going to take has to be of about 10 to 15 mm, and by lumbar puncture we are going to take about 4 tubes, and from in these 4 tubes we are going to label first like for biochemistry, and it is going to be sent to the biochemistry lab for checking the skin commensals. The second will be your microbiology, that is whatever kind of infection is going to be there, whatever kind of bacteria or virus is going to be there will be detected in that. Third will be the cell count. Cell counts, like I told you, like the case scenarios that they give, or the cell counts, that is your lymphocytes and your WBCs, neutrophils, and those things, RBCs as well, are going to be seen in this cell count. And the fourth will be like your cytology or PCR for certain organisms. Now, there are certain places where they don't say 4 tubes, they say 5 tubes, because they take some extra amount. Like if later, if supposingly all of these tests goes negative, so we will be having one more test. We will be having some extra fluid, extra CSF, which we can use for any other purposes. Now, my question to you is, like I always give you one question. This is a very basic question, that if you are going to do a lumbar puncture, what is the site of lumbar puncture? And you are going to tell me for neonates and for adults, two different. And what is the needle that we use for lumbar puncture? Next, see, for an infant, what happens is because of the inflammation in meninges or infection in meninges, this can go to your ear. Now, whenever we are going to start with ear disorders or ENT, I'm going to tell you that there is certain part of your meninges which are connected to your ear, that is your inner ear. Now, if there is a damage in this part, then it is the infection from your brain, like your CSF, is going to go into your inner ear. And if the inner ear is affected, we all know that a child can have sensory neuronal hearing losses. And I will give you one like these kind of patient, what happens is in their childhood they will come with meningitis, and the doctors usually treat the meningitis part of the patient. But if we do not do beta test for the infants, then in later future, what may happen is this infection from the meninges might go into the inner part, the inner ear, and can lead to sensory neuronal hearing losses, which can be detected later in the life. So whenever we are going to do, whenever we test a neonate for meningitis, we also do beta in order to rule out if there is any kind of sensory neuronal hearing loss. Now, whatever CSF we are going to take out, we are going to check for the CSF values. See, this is very important table, and please try to memorize each and everything in this table, because whatever questions they ask are going to be very much specific, and nowadays they are going to make you more more confusing. They are not going to give you any kind of specific thing which will make you a direct diagnosis. So first you need to remember what is the normal values for the CSF. Like CSF will be appearing clear like water we have, I told you, and WBCs are only going to be 0 to 5. Okay, proteins are going to be 0.15 to 0.45. Glucose is going to be like your more than 60% if we are going to compare CSF to that of serum, or 50 to 75 milligrams per deciliter. And opening pressure will be like 10 to 20 centimeters of water, or you can say 60 to 200 of water, and 10 to 15 of Hg. Usually they give centimeters of water, but sometimes in question, in order to trick you, they can give you of Hg or of water as well. Now, this is like you might be feeling it so much confusing that how we will learn this numbers and all. So keep a simple number 5 in your brain, that all the normal values will be like 5555. So WBCs are going to be 0 to 5, 5. Okay, now protein will be 0.15 to 0.45. Now see, the unit in this is given like gram per liter. Now if you go in like gram per deciliter, then the value is going to be changed. So make sure that whatever unit they are using, you see them very properly. Okay, so 15 and 45 are the numbers which you can see in 5 table as well. So 15 and 45. Next, glucose. Glucose is very important. 50 to 75 you remember, because usually they are going to give you in milligrams per deciliter. I have hardly seen some questions where they give you percentage. Usually they give you milligrams per deciliter. So 50 to 75. That is also comes in table of 5. Okay. Now opening pressure is also like 10 to 20 centimeters of water. You remember this, and if you get any kind of question in which you can also see of Hg, then you can remember that as well. So for now you remember 10 to 20 centimeters of water. Now after you have remembered the normal ones, now we go to the abnormal ones, the bacteria, viral, TB and fungus. Now for bacteria, see, any kind of infection is going to be there. You see the last column, the opening pressure for all is going to increase. Of course, these are infections, they are occupying some space in the CSF, and hence the opening pressure for all these are increased. For bacteria, cloudy and turbid. Now you can see clear and cloudy for fungal also. Now what happens now? there were many questions which I solved in this. They sometimes they may give you this cloudy fibrin web or clear liquid, but most of the time they do not describe this. And cloudy you can see in bacteria also and fungal also. So you have to remember the other values as well. Now, see, in bacteria, there is like if the glucose level is going to decrease, then there is a term known as hypoglycosuria. Now, this glucose is decreased in case of TB as well, and also as in cases of fungus. But for virus, it is going to be normal. So, out of four options that they will give you, you can rule out virus on the basis of glucose. Like if the glucose is normal, then viral meningitis is going to be there. Okay, now what about the other thing, the bacteria, TB and the fungal? For bacteria, please do remember that the neutrophils level are prominent, and the WB, like what they might give you, like they will give you the whole WBCs like neutrophils, lymphocytes, everything, or sometimes they may directly say you that the WBCs are going to be this much, like all total, or sometimes other ways. So you can see, you have to remember from both the aspects. Like if they directly give you WBCs means the number of cells, then you have to remember that it is more than 1,000 for bacteria. Okay, what is it? More than 1,000 for bacteria, and it will be having prominent neutrophils. But in TB, as you can see, like viral, we have ruled out on what basis, that glucose is going to be completely normal for it. So you can forget about viral now. We are comparing bacteria, TB and fungus now. Now bacteria and TB, of course TB is also one of the bacteria. So and there are going to be a lot of similarities. See, both the tables are going to, for you bacteria and TB is going to appear completely same, but you see for bacteria the WBCs count are more, a lot more, that is till thousands. But for TB the WBC counts are like 10 to 500, that and that to prominent lymphocytes. So there is this two differences. This side, that is the bacteria side, will be having neutrophils, while the TB side will be having more of lymphocytes. All the others are going to be same between bacteria and TB. Now in cases of fungus, what I give you one suggestion is, for fungus usually they start with immunocompromised and all. But if you are not able to figure out on that basis as well, you can see that almost things are normal except the opening pressure is going to increase and all. So if you see, first you try to rule out that you are able to see the glucose level for virus. For viral meningitis, if you are not able to figure out if it's not viral meningitis, then you can have two options, that is bacteria and TB. First rule out bacteria and TB, and if you find any of them, then it's okay, or you go to fungus. Okay, so first viral, then bacteria and TB, and then to the fungal one. Okay. Now I highlighted what is the important points you need to remember. For bacteria, you need to remember the number of WBCs. For virus, the normal glucose level. For TB, that is 10 to 500 WBCs, and fungal this. Why I am telling you this 4, 5, 6 times? Because this table is very important to learn, word to word or number to number. Because in the question, they, even though you know what kind of answer and how you have to approach it, sometimes because of just remembering a wrong number you can make a mistake. So please do remember the numbers very correctly. And also the units, like here it is cells per microliter, so that time also you need to see the units as well. Now, most of the meningitis are from infection, so we need to remember some of the organisms as well. First, in case of an adult, these are the three common organisms. I have mostly covered like the common organisms or the common questions they will ask you about. So I have not covered each and every organism, but most common ones. So in adults, and most commonly asked questions. Okay, in adults, the first will be, the most common one will be your Streptococcus pneumoniae. Next will be your Neisseria meningitis, or you can say meningococcus and Haemophilus influenza B. In neonates, it will be your group B Streptococcus. E. coli will be the most common organism, and then Listeria. Now this is a whole list of most commons. Like most common for 1 month to 2 years will be Streptococcus agalacticus. For immunodeficient and elderly, it will be your Streptococcus pneumoniae. Like you can also see in adults, Streptococcus pneumoniae is most common. So immunocompromised and elderly also do comes in cases of adults. So you can remember this like Streptococcus pneumonia. Now in head trauma, post neurosurgery, post CSF shunt, it is Staphylococcus aureus, or you can say that Cones CONS1, which is responsible because these kinds of organisms are mostly on the surface of your skin, and that will lead to this kind of infection. Now, how there are two ways in which we divide meningitis. The first one is your septic and aseptic one. The other one is your acute, subacute, and the chronic one. So now, in case of septic and aseptic, how you are going to say this? Usually, they don't ask you questions on this, that if there is acute, subacute, or chronic. Just in order to complete it, I am just telling you this. Like for septic one, septic and aseptic is on the basis of the pyogenic organism which we can see. So septic means you are able to see the pyogenic organism. Aseptic means you are not able to see the pyogenic organism. In septic, if you are seeing pyogenic organism, what are those? This can be a streptococcus pneumoniae, Haemophilus influenza B, and also meningococcus. The For aseptic, it will be viral, or it can be protozoal or bacterial. Most commonly, it is going to be viral. Now, in aseptic meningitis, as I told you, that there is no pyogenic organism in it. So, gram stain will be negative, your culture will be sterile, and the most common virus which you can find will be your enterovirus. And also, as I told you, that meningitis is not just because of infection, but most commonly we have infections. But if you see the non-infectious part of meningitis, then we have some rheumatological disorders like your Sjogren's and all. Okay. Now, for acute, subacute, and chronic types, just like acute, subacute, chronic, if the word itself is acute is just for 5 days, subacute is for 5 to 30 days, and chronic is more than 30 days. Now, this in this basis also we can divide like usually acute will be your bacterial, viral, and subacute will be your TB or fungal, and chronic I told you like TB and fungal. Usually, like fungal will be the one which will have fungal and TB both will be having some long history and immunocompromised patient.